Okay, so we all think we know the story with weight and blood pressure, right? It feels like something we've been hearing from doctors forever. But what if that story is changing? What if some of the newest data is telling us there's a hidden crisis, one that's actually speeding up right under our noses? Let's unpack this. And just to be super clear right from the start, this connection, it's not just some small correlation. Obesity is a major driver of high blood pressure, hypertension. And really understanding just how powerful that link is, well, that's the key to everything else we're going to talk about. So just how powerful are we talking? Well, get this. The landmark Framingham Offspring study found that an estimated 78%, that's a huge number, of high blood pressure cases in men were directly caused by obesity. For women, it was 65%. So we're not talking about a minor contributor here. For millions of people, it's the main cause. So let's start at the very beginning. Section 1, the foundational link. To really get what's happening today, we first have to understand the research that all of this is built on. It's the bedrock. This quote really gets to the heart of a finding that has held up for decades. Basically, that same Framingham research divided people into 4 groups based on their BMI. And what they found was that folks in the highest BMI group had a systolic blood pressure, that's the top number, that was a full 16 points higher than people in the lowest group. The connection was just so direct and consistent. More weight equaled higher blood pressure. That was the established fact for a long time.
But then, right around the turn of the century, the story started to get a little bit, well, complicated. So in section 2, we're going to look at how the data started sending some really mixed signals, creating what seemed like a paradox.
And this slide lays out that paradox perfectly. A study looking at data from 1999 to 2010 found something really curious. On the one hand, the good news, we were getting way better at treating high blood pressure. The number of untreated cases dropped like a rock. That's awesome. But on the other hand, the actual number of people with hypertension, diabetes, and bad cholesterol was still highest among obese adults. So what's the takeaway? Our treatments were getting better, sure, but the root problem itself, it wasn't going anywhere. And that brings us right to section 3, a hidden obesity epidemic. Because while that earlier data showed we were making progress with treatments, the most recent data, well, it uncovers a much more alarming trend that was kind of hiding in plain sight. Which of course leads us to the big question. If our treatments were getting so much better, did the problem itself start to fade away? What exactly is happening right now? And the answer, as you can see from this chart, is a massive no. This data from 2001 to 2023 is just wow. Take a look at the first bar. That's the increase in obesity among people without high blood pressure. It goes up, but it's a pretty gentle slope. Okay, now look at that second bar. This is for people who already have high blood pressure. The rate of obesity just skyrockets, jumping from just under 40% to over 55%. This isn't just growth, you guys. This is a dramatic acceleration of the problem, and it's happening in the most vulnerable population.
But believe it or not, the story gets even more specific. So for section 4, we need to zoom in even closer on this trend, because the really concerning part is hidden inside that huge increase. Let's talk about the rise of severe obesity.
All right, first, a quick primer so we're all on the same page. Clinically, obesity is often broken down into grades based on body mass index. Grade 1 is a BMI of 30 up to 35. Grade 2 is 35 up to 40. And grade 3, which is what we call severe obesity, is a BMI of 40 or higher. Just keep those 3 grades in your head for this next slide.
Okay, so here's how those grades have changed over the last 2 decades for adults who already have hypertension. For grade I, you see a bump in men, but it's pretty flat for women. Grade 2, it went up for everybody. But look, the real story, the most alarming part, is in grade 3, severe obesity. For men, the rate more than doubled. And for women with hypertension, it also more than doubled, jumping from just under 11% to a staggering 21.2%. This is where the epidemic is just raging.
So here's the absolute crucial takeaway. The prevalence of grade 3 obesity, the most severe form, has nearly doubled among people who already have high blood pressure, and it happened in just 20 years. That is an absolutely mind-boggling acceleration of a very, very serious health risk. So, who's behind all this? The answer might actually surprise you. We tend to think of these issues as affecting older adults, right? But it's actually younger and middle-aged people who are driving this trend. Adults with hypertension between the ages of 20 and 64 make up more than 3/4 of this entire increase. It's a huge deal. Which brings us to our final section. After seeing all this data, the question that just hangs in the air is, what happens next? So let's just quickly recap the story we've uncovered here. First, that link between obesity and hypertension, it's fundamental. We've known about it for years. Second, for a little while, our improving treatments were kind of masking the fact that the underlying problem wasn't actually getting any better. Third, and this is the big one, today we can see that obesity is growing fastest in the exact group that's most at risk, people who already have high blood pressure. And finally, the most severe kind of obesity has nearly doubled in that high-risk group in just 2 decades. This all really highlights the challenge we're facing right now, and it leaves us with one last pretty critical question. The data shows this problem isn't just growing, it's getting more severe, and it's accelerating, especially among younger people. So the question we really have to ask ourselves is this: are our public health strategies, our solutions, our medical treatments, are they evolving fast enough to keep up?